All right, good morning. It is 11 o'clock. I really want to make sure that we stay prompt when we get these back to basics started. First and foremost, good morning and welcome. And I'm really glad you're here. We have a lot of people on today, which is exactly what was expected to be. Those of you who have your camera on, great to see you. I'm going to share with you real briefly in the room with me. As you can see, if anybody can see where I'm at, is I have the social work administrators, STAMs, help desk folks are all here with me today because we are having our quarterly CPS leadership meeting. That's actually really not quarterly, it's bi-monthly. We started it out quarterly, it's now bi-monthly. So I want to let you know that they are all present in this room with me today. Before we get started with our presentation on SafeCare, just a couple of things as a reminder with Back to Basics is that it is mandatory for people to attend. We talked about in the CPS town hall that if, of course, people are on vacation or out sick or in court, they can certainly watch the recording as it will be recorded every time that we do it, and that recording will get sent out. Claire will be sending that out once we're finished. Lastly, there was a lot of confusion about where's the invite? So when the email comes out, there's an attachment on the email that has the invitation. So that's where you can anticipate finding the invitation to these back to basics. So I just want to highlight that so that everybody was aware that was maybe still confused about where to look for that. I know that's maybe a little bit different than what it's usually sent out as, but want to make sure that you're aware. We're going to get going with SafeCare because we have said that these back to basics presentations will last between 30 and 45 minutes. We will hold to that. So if Andrea or Sarah is still talking, we're just going to hang up. Just kidding. We won't hang up, but we will flag it for them that we're getting towards that time frame so that you guys can move on to do the other things that you have to do on your list of things for the day. But I do want to thank Sarah Buis and Andrea Hickman for being willing to lead this conversation today around the important service that we have called SafeCare. They're going to kind of walk through all the things SafeCare. For some of you, you may feel like, yeah, I already know all this stuff. But for others, it may be somewhat new or even a good refresher or a reminder. And that's really the intent behind Back to Basics, is to make sure that we are having some of the things that we quite frankly have already talked about at some level and that you're already aware of, but having a reminder of whether it's a service that we're doing or a policy that we need to follow is really important. So short and sweet. Hopefully, like I said, we'll be done here in about the next 35 minutes for sure. So I'm going to go ahead and hand this off to Sarah and Andrea.
All right. Thank you, Lori. All right. Welcome, everybody. We're going to jump into some in-depth discussion about SafeCare. So as we explore SafeCare within the array of services offered to families, I want to make sure we get on to our next slide first, though. There we go. Thanks, Claire. As we explore SafeCare within the array of services offered to families involved in our child welfare system, it's important to understand how the services work together to support our families. SafeCare is housed within the umbrella of family casework. As the family transitions from assessment to ongoing case management, a referral is made for family casework to engage with the family through motivational interviewing to address the identified safety concerns and assist the family in making necessary changes to reach safe case closure. Throughout the life of a case, additional services may be utilized to support a family. SafeCare, FFMs, or YTDMs and family interactions may be referred based on case need. Or if a child or children are placed with relatives or fictive kin, kinship navigator services may be referred, and family preservation services are available to both during assessment and ongoing services to prevent removal. Today, as we further explore SafeCare, I want to highlight how families can find success through a combination of different services dependent on their specific needs. Our first success story focuses on a parent with supervision issues for both children, ages 14 and 5, with the older child needing mental health services. The condition of the home was also a big concern. In addition to mom not getting the children to their wellness appointments, she struggled with active parenting, was not following through on rules, routines, and consequences for both children. Family had prior services with HHS, but nothing for nearly 5 years before our current involvement. Throughout the life of the case, family preservation, CSCs, family casework, FFMs, and SafeCare were referred to support the family. Often families may need a combination of services to meet their specific needs, address safety concerns, and support parents in achieving safe case closure.
All right, so just a brief overview, reminder of what SafeCare is. First and foremost, it is an evidence-based intervention. And what that really means is that these services have been evaluated through scientific research processes, and they have been determined to be effective and to show progress and positive outcomes for families over a long period of time. These evidence-based interventions are part of our efforts to continue to strengthen and improve our child welfare service delivery to families, and we want to know that we're using programs that work. With SafeCare, we work with the National SafeCare Training and Research Collaborative out of Georgia State University, who have conducted extensive research on SafeCare to show time and again that it is effective and it is supportive to families. We actually continue to work with SafeCare or with the National SafeCare Training and Research Collaborative on ongoing evaluation of what SafeCare looks like in practice here in the state of Iowa and what sort of impact it is having. And on the CPS public webpage that we have, there is a link for SafeCare. And under that link, you can review the evaluation reports on the effectiveness of SafeCare that have occurred in the state of Iowa over the last couple of years. So as we continue to grow that practice and continue to work with our SafeCare partners at NSTRC, we are continuing that evaluation. We are also looking to expand that evaluation to really demonstrate the difference in impact that SafeCare makes by evaluating families who don't receive SafeCare and families who do. So as we continue to move that forward and we look at our SafeCare program, it's short-term, evidence-based, behavioral, and they're in the home. They're working with the families week in and week out. Each module, health, home safety, and parent-child or parent-infant interactions, is delivered over 6 sessions. And we'll talk a little bit more about what that process looks like as we continue forward. But we're using a lot of real-world examples and role modeling and coaching with families to help them build those skills. And Andrea is going to talk a little bit more about what sort of impact that has had with the family she described before.
So reflecting back on the first success story I just talked about, through the use of a wide array of services, the family made significant progress. Specifically, the SafeCare provider did a great job encouraging and supporting mom. She met mom where she was at, worked to get her engaged, and built rapport. She encouraged mom to address her own physical health concerns during the health module. And as mom started to feel better, she was able to take on more tasks and moved on to getting the home environment to an appropriate condition and appointments better organized and scheduled. She was able to demonstrate the ability to complete multi-step tasks to ensure appointments were scheduled, transportation was arranged, and her appointment calendar was kept up to date. She made great progress in setting and maintaining routines and establishing herself in the parent role with her youngest child. In addition to SafeCare, the older child entered PMIC during the case and has successfully returned home. Mom participated in her daughter's IEP review and new classroom accommodations were made. Individual therapy was established for both mom and the older child, including med management. BHIS was also initiated for her daughter before she entered PMIC placement. At this time, mom has maintained care of her younger child in the home with the support of services offered and has both children back in her care. She's been able to get the older child to and from appointments since returning home from PMIC and has maintained the condition of the home. The department is hopeful that safe case closure will be achieved at the next court hearing. So looking at eligibility criteria for SafeCare, Families are eligible for SafeCare when there are open HHS services for the family or when a family has accepted a referral for non-agency services and there is a child age 0 to 5 in the home. Kin and fictive kin caregivers who are caregiving for child victims ages 0 to 5 may also receive SafeCare. Parenting teens are also eligible for SafeCare even if their child does not have an open case. In this instance, you refer to SafeCare under the teen state ID number and note for the provider that the teen has a child who is 0 to 5. When HHS has a non-court involved open case with a family, the referring worker may make a referral to SafeCare without also referring to family casework, if SafeCare will address the family's needs. Families are eligible for non-agency services. They're also eligible for non-agency SafeCare if there is a child 0 to 5 in the home. Non-agency SafeCare may be referred as a standalone service when non-agency SafeCare will meet the family's identified support needs and the family is willing to accept non-agency SafeCare services.
So when we are making referrals to SafeCare, they can be made at any point in the life of a case. What we are really looking for is, does that family have a base level of stability? And really what we mean by that is we want to make sure that parents aren't continuing to actively use substances, that they're not in an active mental health crisis, that they have stable housing. They just kind of have that base level of feeling like they can handle the right now and have some capacity to learn and to build on information that they have that they're provided during SafeCare sessions. So when making a referral, we want to include the 3055, the referral phase sheet. I think there is a spot to mark SafeCare as one of the referred services. If it's only been a couple of weeks since you made the initial family casework referral and you're referring for SafeCare, it's okay to just send the 3055. You don't need to send the referral phase sheet. But make sure to note for the provider agency whether this service is directed at one particular household within the family or if it's multiple households so that they can make sure to set up services appropriately. Non-agency SafeCare referrals do look a little bit different. They're very similar to our non-agency service referral process, where we send the assessment report and an email authorizing SafeCare services. There's no 3055s involved or anything like that. But it is really about making sure that we're keeping families connected to those programs. With referrals, when we have an agency case and we are at a point where we have achieved safe case closure or the court intends to close the case, we can talk with the family and determine if they're willing to continue to work with SafeCare if they have not finished that curriculum yet. And if they are willing to accept that referral, make sure that you send a closing referral or a closing 3055 on the open agency SafeCare, and then a separate email indicating that you are referring for non-agency SafeCare to allow the family to complete the program. We really do want to make sure that every family gets every opportunity to complete all 18 sessions of SafeCare and have the full service delivery that supports safe and healthy parenting.
The delivery of SafeCare services should primarily occur in the family's home. Sessions should last 60 to 90 minutes and occur during regular family routines targeted by curriculum, such as bath time, meals, playtime, etc. The pre-test at the start of each module and the post-test at the end demonstrate caregiver skill growth, and modules can be delivered in any order determined based on the family's needs. There is a specific structure to delivery of SafeCare curriculum. There are 3 modules: health, home safety, and parent-child, parent-infant interactions. And within each module, there are 3 phases: the pre-test, which determines the parent's current skill level related to the module, the activities which provide instruction, coaching, and practice, and the post-test, which evaluates whether the parent has improved their skills within the module. The pretest also helps determine whether parents have mastered any of the skills taught in the individual sessions. If a parent has already mastered skills for a session, the provider will move on to the next session.
So as Andrea said, there are 3 modules to SafeCare. There's health, home safety, and parent-child or parent-infant interactions. In the health module, our goals are for parents to know how to keep their kids healthy, what to do when a child becomes sick or injured, and recognize when we need to seek which type of medical care. Is it a phone call to the primary care provider's office? Is it a visit to urgent care? Is it a trip to the emergency room? Really helping families understand at what level do we go to which type of medical care. And also teaching them how to keep good health records, making sure that when they're giving their child Tylenol or ibuprofen because they've got a fever, that they're tracking those kinds of things so that they know this is the last time I gave that medicine. The earliest it would be safe to give it again is at this time. And also just keeping track of things like immunization records, general history of illnesses, all of those things so they know what to do. Um, and making sure that they have the basic tools needed to care for a child, like a thermometer and thermometers and nail clippers and those kinds of things that just help keep kids generally healthy.
Our second success story involves a single mother parenting a newborn child. The family became involved with HHS when the baby tested positive at birth, and mom was a young first-time mother. SafeCare was referred shortly after services were initiated. Mom completed the health module of SafeCare and has stated that she refers to the binders regularly, particularly for the medical health issues. Mom was observed to be very attentive to baby during her sessions, and mom's home was always tidy and clean with appropriate safety items in place. The different supports mom utilized during her case were WIC, SNAP, Medicaid for herself and her child, in addition to housing assistance. She also has informal supports that she is utilizing to help with regular parenting activities. And in this case situation, services were successfully closed within 7 months. But mom really highlighted the support and the benefit of SafeCare and what she learned through the health module that she participated in. The 4 goals that are contained within the home safety module are understanding the importance of a safe home, knowing the types of hazards within the home, understanding ways to improve those hazards, and understanding the importance of supervision.
For our parent-child or parent-infant interactions modules, we're really looking at building those parent-child or parent-infant relationships, teaching parents how to strengthen their bond with their children through more than just those basic caretaking skills, uh, but also those little day-to-day moments and interactions that mean so much to a child's healthy development of a bond with their caregiver. And helping parents really understand how to set boundaries with their kids and follow through on those boundaries on a consistent basis. Um, Planning and organizing daily activities as well as their play activities. So knowing that lunch is coming up, they're going to start to set a routine of this is what I'm going to have baby do while I'm preparing lunch because I don't want my crawler getting into unsafe stuff. So I'm going to set them in a high chair with a couple of Cheerios or something like that to keep them busy while I make their lunch. Just planning those activities and knowing how to handle those day-to-day routines so they feel confident and then in turn their children feel safe because they know what to expect day to day. Building positive interactions with families or with children and knowing, like I said before, those little things that make a difference. Hugs and high fives and snuggles and tickles and all of those things that really help children feel that relationship and that affection from their parents, and help them feel like their parents care about them as people. And then also preventing challenging child behavior, setting routines, setting boundaries, putting those things in place, and then also helping parents understand how to follow through. Like Andrea talked about with the first family, mom really learned how to be in that parent role, and managing their child's behaviors day to day, which then gave her confidence as her older child returned home to be able to keep those things in place and put that bigger picture together to be very close to safe case closure at this point in time.
Well, as we think about SafeCare and how we can utilize this program and or gauge its success, HHS plays an important role in the success of our families through identifying a family's needs and making appropriate referrals for services to educate and support parents. So it's important for us to advocate for SafeCare referrals based on the family's readiness. Are they stable, willing to accept a service? If so, talk to your provider agency about a referral for SafeCare. Generally, they're probably already in the home working with the family through family casework. So always a good conversation to have. Is this family ready for this service? Regularly ask the parents about their progress in the SafeCare modules. What are they learning? What are they doing? Take notice of changes that you observe that are reflective of improvements associated with SafeCare modules and sessions. And ensure that you're regularly following up with the family SafeCare provider and FSS regarding progress related to SafeCare. What are the providers seeing in the home? SafeCare provider is doing that pre and post test. What improvements we're seeing, and are we seeing that parent maintaining those throughout the case? And that's something that your FSS provider is going to be able to articulate as they're working with the family ongoing. All right, well, that concludes the presentation. Are there any questions?